Hi, Dr. Tatiana here. So this exercise is called the cervical orthotic exercise. It's been prescribed to you to help bring back the C curve in the neck, most likely because on your films you've had a straightening of the neck. So we don't want to have a straight neck, we want to have a nice reverse curve, like a banana in the neck. So you see that this unit here has two wedges on it, or two slants. You can see there's a larger slant. The larger slant is going to be going underneath your shoulders. Now when your chiropractor says upper, middle, or lower, or mid to lower placement, that means this is what you're going to be placing against those sections of the neck. So I'm going to come a little bit closer so Kayla can get this video. The upper neck is right underneath the skull, okay? A very rare place for us to place, but that's where the upper neck is. The lower neck is the C7, so this big bump at the bottom of the neck, the biggest vertebra, the spinous process is the biggest vertebra, that's the lower neck placement. The mid neck is just right in between. So what we're going to do is we're going to do a mid to low neck placement today. That tends to be a very common one. So you want to be doing your cervical orthosis on the ground. On your bed, you're going to have way too much give and you're not going to get the support you need. Now, if you have issues getting up off the ground, make sure you're doing this when someone's around to help you. For the timing, your chiropractor may suggest something different, so make sure you're looking at the sheet that the front desk gives you that tells you how often and what timing you need to do. But in general, we'll start with about 1 to 2 minutes in the evening and add a minute every couple of days until you reach 20 minutes. And this is going to be your relaxation time every night. Now, when I prescribe the cervical orthosis to patients, some may also get what's called the panning exercise, which you can find that video online. If that has been prescribed to you, it's a wonderful active exercise to do along with this passive support for the neck. And in a lot of cases, the active support is necessary to hold the passive placement. So remember, it's an orthotic. Just like an orthotic for your feet, it's an orthotic for your neck. So what you're going to do is place the flat part here on the table, okay? You'll also notice from the side that there's a few different segments. We've ripped this one apart. Your chiropractor will let you know if you need to remove one of those labels, and this can be used for more than one person in the house. So let's say the littles or the kids have to use it, they can use just this portion. What we suggest is use 2 thick elastic bands or hair elastics to put the unit back together so that when mom or dad need to use the orthotic, they can use it as well, and this doesn't go missing somewhere with all the kids' toys or Lego or something like that. So you make sure that you have that around. So we're going to put the flat portion on the ground. Once again, this wedge is going to be towards my body. I'm going to take a seat. Normally keep the knees bent, so what we're going to do is lower slowly. We don't want to smack our head down into the unit. I find the tip right here, and what we're going to do is I'm going to find that bump on my neck and go just right above the bump on my neck, and I'm extending my neck completely. So as you can see, there's a nice reverse of the C curve. Most common mistake I'm seeing with patients is that they're putting the placement right up here. So what's happening to my neck, Kayla, when I'm doing that?
You're straightening right
Straightening it, exactly. We don't want to do that. We don't want to put more tension on the spinal cord. So once again, find the apex, find that bump down there. So if you're a lower neck placement, you're going to go here, mid to lower neck, right in between there. Just place and extend completely and just hold. To get up, make sure you're rolling to your side. You're going to use your hand on top to push and come up into a seated position. And that is your cervical orthotic exercise.